Some friend of mine believe that the knowledge of basic principles about medical liability concern to physicians in everywhere of the world. In turn, I would like to say now what is my practical perception from the judicial and medical point of view. I was said that the development of science supported on technical resources affect the protagonist paper of physician in the fight for getting better health for humankind. I think that's not true, but the leader condition of doctor at the present is not so strong like in the past. What is the reason for it? Only one. Patients see their doctors in a silent world, generally very far of them. What the patient thinks apparently is not important for some doctors, so the dignity of patient is affected, and as a consequence, the leadership of doctors could disappear. When somebody suffers illness without contact with the doctor, you cannot say that the sick person is a patient. The relationship between the people sick and the physician born or is formed only when he attends to the hospital, clinic, or doctor's office, and when doctor asks about the patient illness and the possible cause of it. And he makes a physical evaluation of the patient. Appear the so-called medical-patient relationship. Before now, when the first meeting between doctor and patient occurs, in order to medical attention in the field of that kind of relation appear feelings, convictions, moral and ethic postures, knowledge, cultural factors, attitude, and information. It is so much like the meeting between a conscience, the one that generates the ethical medical duty, and hope, that of the patient to recover the lost condition of his health. At this moment, multiple effects born to the juridical life. I would like to examine some of these situations. By this way, emerge the necessary precedents of illness, and other indispensable elements, previous, or of the essence, so that born a contract of private right that is as regulated by the civil code in each country, and that doesn't need for the legal validity that consists in reading. In effect, in opportunities it is celebrated in verbal form and without special solemnities, but not for it stops producing all the juridical effects of an agreement in which generally there is clear the capability of the parts to put under an obligation, and at the same time that there is known well the target or intention of the treatment or intervention that the parts withstand. In other opportunity, I will talk about informed consent for treatment. That will be in the future. The contract will begin to be executed by the first step for the development of the treatment, which comport, for the doctor, the search of the personal and familiar precedents by means of a complete or finished anamnesis of the same one. There is always imposed his rigorous physical clinical examination and the perception of his pathological condition to come by this way to a diagnostic presumption when not to a clinical diagnosis of first opportunity, based, when it is necessary, on the examination that support diagnosis or treatment, sometimes, like in the basic labs, are processed rapidly, and others are very sophisticated, and the results delayed. The initial attitudes of the doctor are identified by the search of the full film of the control target. In turn, the patient has reactions, attitudes, questions, and feel as answer to the prescription orders and instruction of the doctor. In general, all of both positions identify the initial development of contract. From the beginning of medical history, doctors have been fighting without rest against illness. Now it is necessary physicians have in their hands the leader's flag in order to get better health for all and the protection of life. Technical resources are important instruments for working, but in the center of the field of actions must be always the doctors, every time closer to their patients.